Hi, everyone. Welcome to another Facebook Live for Chase Brexton Healthcare. My name is Aaron Cahall. I'm the Communications Manager for Chase Brexton. And here with me today is Amit Dhir, nurse practitioner at Chase Brexton, one of our infectious disease specialists, whose work focuses on HIV PrEP, and sexual health generally. What we wanted to get into today is a little bit of a Q&A about sexual health. Cover a lot of topics, so treat this as a sort of an Ask Me Anything, any questions you might have generally about sexual health or ways to get tested, things like that. We'll try and cover all that in the next few minutes. So I guess the first question I have for you is, that COVID has changed so much of the landscape of healthcare and medicine. How has it changed sexual health care in these last 2 years?
Yeah, thanks, Aaron. Thanks for having me. And as Aaron said, I'm one of the infectious disease specialists at Chase Brexton, and largely my focus is in sexual health, HIV and HIV prevention. So speaking from the standpoint of how COVID has, really impacted sexual health from when it started till now, COVID has definitely taught us many things. Has bent us in many ways, have made us more resilient and even stronger than before. And I think just thinking back from when it first started, everybody was scared. What am I going to do? Yeah, and we talk about HIV prevention, STI prevention. People were always asking me questions, how can I be with my partner? How can I, do things safely? So I think a lot of the questions that comes into anybody's mind, how safe is intimacy with a partner? Well, with that, we say there are many forms of intimacy that requires a closer distance with your partner. But, as CDC says, 6 feet of separation is recommended by the CDC to maintain a safe distance from your partner. But yet this does not mean that you should isolate yourself from your spouse or your partner and stop being intimate at all. If two people are healthy and feeling well and are practicing social distancing and with others and have had no known exposure to COVID-19, touching, hugging, kissing, and sex are more likely to be safe. Similarly, sharing a bed with a partner who's healthy should not be an issue either. But we do have to be aware of the things we have learned over the last 2 years, that some people may have the virus and not yet have symptoms during the early part of their incubation period, what we call the pre-symptomatic period of the virus, when somebody is infected. Additionally, some people may never develop symptoms, where we call it asymptomatic. So there's confusion about that. So what about intimacy when a partner has been ill? We talk about now that we started with 14 days back, 2 years ago, and now we have come down to 5 to 7 days. And if you are asymptomatic, you could get back to normality of things as long as you don't have symptoms. But we do think that the virus stops becoming active by 5 to 7 days.
A question from the chat, kind of touching on some of this that you just talked about. It, can I get COVID from sex? I take that question to mean is sexual contact a actual transmission vector or transmission route for COVID? Maybe separate from obviously proximity, being close to someone physically. Can sex transmit COVID? So
a little refresher on the COVID virus. So how is COVID spread? Respiratory droplets, aerosols. Somebody could be breathing, singing. You can get it that way. It can live on surfaces. So if you're coming in close contact with, where you are exchanging, respiratory droplets, aerosols via the mouth, yes, you can get it. But to answer, I guess, more specific, if you're having vaginal versus rectal sex, it is unlikely to be spread that way. Now, some studies early on did show that it could be found in feces, semen, vaginal, fluids. But we did find later on it wasn't really spreading via insertive sex or somebody receiving or giving.
It is respiratory, right?
Yeah.
It's those droplets that we
respiratory or aerosol.
Aerosol, right? Were there specific trends or medical challenges, some new issues that may have emerged from the pandemic related to sexual health that either weren't there before or somewhat on the back burner? Is there anything that any need or trend that the pandemic has really brought to the fore?
Absolutely. Pandemic brought a lot of challenges in terms of sexual health, managing clinics. So when I speak about sexual health, I speak from the overall perspective of, being able to see our patients, managing their sexual health. Sometimes people need a little hand-holding, and that's okay. And the trends we've seen, initially when the pandemic first started, people were, obviously we were all very scared. We stopped what we were doing. We stopped being intimate with each other in different ways. And as the people got vaccinated, there was some comfort, was coming along and over time, and now Omicron. So within that time period with, back and forth between different guidelines and comfort with vaccinations, we did see, over time now, the rise in STIs getting more diagnosed, and the HIV rates getting, they slow down, and then they getting back on, the trend high up, where, because people were disconnected from care. Pandemic really disconnected and dismantled the whole system. There were clinic with reduced hours. Some clinics had to eliminate and reallocate staff resources or temporary close. So those were the challenges were faced by clinics, which in turn affected our communities that we work for, that we are working so hard for, so we keep our, the HIV rates low, or, our goal is to completely eliminate HIV from the world, and even STIs, and keeping the STI rates low. So those were the challenges we faced, and we did see a rise. And I think over time, we, as I said earlier, we became more resilient. We became more stronger, and we adapted to COVID-19. And we are now able to give access to our patients in a way they want. We're able to provide services in many different ways: telehealth, video, audio. Sometimes it only takes a phone call just to connect to our patients, to make them feel, connected, valued, and feel secure. I think all these challenges have taught us how to be innovative with our technology and still keep our patients in a safe environment.
Right. So just to be clear, there's a question in chat. Has there been an uptick in STIs, maybe separate from HIV, STIs like chlamydia, gonorrhea? Where on the curve are we with that? Has it been brought back under control, or are we still seeing a rising number?
So it's a fairly new trend, and the data. So when we collect data for STIs, we don't get the data available 2 years later when the state health departments or the CDC collects data. So clinically, what I'm seeing, I did see a rise in infections, I would say starting 2021, not starting 2021, but like mid 2021. And then till now, I would say it started to rise pretty quickly, pretty steeply. And then now it sort of is staying the same way, but the rates are still a lot. The numbers are growing. Even though they're stagnant, but they're large numbers.
Yes, that makes sense. I want to do a little bit of a lightning round if you're up for it. We're getting a lot of questions on chat, and I want to make sure that we cover those. These are the questions that we're here to answer. Question: I've heard using poppers during sex can make one more susceptible to getting HIV. Is that true?
So that's not necessary. It's not a direct relationship of poppers and contracting HIV. It's a relationship when we talk about that, being under the influence and having a high risk activity, similar to, consuming meth or Viagra, combining or poppers all together, increasing somebody's risks to, you're intensifying your sex and getting involved in more high risk behaviors that you might not think that you might otherwise think when you're sober. You could, your sex could be more intense where you could get, a tear in your vaginal opening or anal opening where you are exposed to more blood. There are other STIs like hepatitis C, can be exposed via blood to blood, which is a disease which we have a cure for now, but used to be a chronic disease like HIV. So it's more so increasing the risk with the risky behaviors rather than directly increasing the risk of HIV.
That makes sense. So an age-old question, Seer, is anal douching before sex okay to do? Does it make one more susceptible to getting an STI or HIV?
That is actually, even though it's asked as a question, I would say yes. Anal douching does make people more susceptible to STIs. Think of, as humans, we carry, bacterias, types of fungus on our body, which are normal to our skin, our tissues. We call it the normal flora. You are getting rid of, when you're douching, you're getting rid of the normal flora from your anus or vagina. And you're, with douching, you're not just getting rid of normal flora, but also you're inflaming, means you're getting your tissues angry more. So when there's an inflammation, there's a more risk of entering things into the tissues. So exposure increases, the risk increases of contracting something with douching for sure. And it also matters, what is safe douching? There are, when you go to CVS, Walgreens, they have, or online, they have douching products, which are mixed with all these chemicals. Those are a big red flag, a big no, never use those. They definitely put you more at risk for contracting because the chemicals alter your microbiome a lot more than doing just douching with water only.
I see.
So a safer way of douching could be that.
Is PEP still a thing? We used to hear maybe a little more about PEP. This is post-exposure prophylaxis. What's the deal with that right now?
Yes, PEP is still a thing. We continue to see exposures to HIV actually through the pandemic, even now. So yeah, we are in our PrEP clinic. Obviously, we have that great service for our patients for HIV prevention. But within the same clinic, I also offer post-exposure prophylaxis, and it continues to be a big modality for somewhere where somebody is exposed to HIV and they come in within 72 hours. We're able to provide that immediately.
And what about PrEP? Can I get it through the mail? Do I need a prescription, either from Chase Brexton or from any other provider? How can somebody get PrEP if they need it? How do they start?
So PrEP is one of the easiest things somebody can get on and start on with Chase Brexton. We have a very well-organized PrEP clinic where a great teamwork, where patients can get easy access to PrEP. And when a patient comes in, obviously a provider has to write a prescription, but they can pick up the PrEP after it's being written right at our pharmacy. And if they prefer delivery, we also provide free delivery to our patients so that to eliminate any barriers we can for our patients to get access to PrEP.
Great. On the same subject, someone asked, does Chase offer walk-in STI services at this time, or do you need to make an appointment? Presumably thinking of the STI clinic that we've had for several years.
Yeah. So the walk-in STI clinic is not functioning at the moment. We're in the process of reestablishing that. It was a program we had with the Baltimore City Health Department where we were able to give access to our community to STI testing. With pandemic, of course, you know, all the challenges and barriers, funding, a lot of things got changed. So we are working very diligently to restart that back up. Now, for our patients, the Chase Braxton patients, we are able to see them in the PrEP clinic for STI testing and treatment. For patients who are not Chase Braxton patients and are interested in starting PrEP and getting tested, PrEP clinic is there for them, for anyone who's interested, either Chase Braxton or non-Chase Braxton patients for that purpose.
So to circle back to an earlier, in the previous video segment, if anyone's still with us, Amit had mentioned that there are some rising rates among STIs we're seeing. Chad asks, why do you think it's rising? What factors do you think go into that? And understand the data may not be reflective of this moment in time. Maybe clinically, if what you're seeing there, what do you think is influencing that?
Yeah, so I think a lot of the influences now we know are very clear. What COVID had done initially with a lot of changes, a lot of cut down with staff and clinic hours in a lot of clinics, and just overall changes. Patients were lost to care. And we saw that trend all across not just the U.S., the world, where access was a big issue within the medical system. Patients lost insurances, not just follow-up and follow-up care, lost their health insurance. So people were just sitting at home, didn't have a contact with a doctor or didn't want to, were scared, were anxious, were depressed, and a lot of other factors. And as things were start to get better, people start to feel comfortable and they will start to get out more, not realizing that we have not connected back to our providers, our healthcare system, and the risk factors that were there before, they still existed. And so it's not just it's an encompassing issue of many different problems. Patients who were HIV positive, they also got lost to follow-up care. They weren't able to access medications. With time, it got better for sure. We saw some of the best engagement in care through pandemic because we were able to deliver medications and be able to see them online. But in the first few months, if patients didn't have their medications, their viral load will go up. That could be a risk factor, and definitely a risk factor actually for transmitting. People were not on PrEP because they thought everything was safe. They're just going to stay home for the rest of the year. But we are humans. Our minds change, things change, and we feel comfortable in different ways depending on how things are thrown at us. So a lot of things led to increase in not just the HIV rates and STI rates increasing, but also people, a lot of mental health issues started rising because people were just anxious and depressed from the COVID pandemic and what it's going to do to them.
Sure. A couple of HIV-related questions. I want to also call it and acknowledge today is National Black HIV and AIDS Awareness Day. We'll have some posts about that on our social media. You'll probably see some hopefully around as well. And an important awareness day, of course, here in Black History Month. Something we just want to acknowledge as we tackle a couple HIV-related questions. One is, I've seen some things about an HIV vaccine that's under development. I actually meant to ask you about this myself because I'd seen the same headlines. We've seen this come up occasionally a couple times in the past, decade or more. And initially with the COVID vaccines, there was talk about the mRNA structure of that vaccine maybe having been, both coming out of and maybe having benefits for combating HIV. do you think that there's promise either for this current trial or that we'll see any kind of an HIV vaccine soon?
When it comes to research, so you're right. There was just a recent trial started with mRNA vaccine for the HIV prevention, like a COVID vaccine or a flu vaccine. But it's hard to say so early on if there is a promise to a vaccine. Obviously, we have tried different vaccine modalities before in a research trial, and they were not efficacious because they did see that it didn't mount a response after a few months to be able to prevent it. I would hope it's promising, but I think we would have to wait for more data to be released to see how the mRNA vaccine could tailor to HIV prevention efforts with antibody responses. The HIV virus is so unique, it hides in different spaces, bone marrow spaces in the body, that it's unique in a way like that. COVID virus is different. It's found in respiratory droplets. It's like flu virus. We can tackle it more, on the surface, not on the surface of things, but on surface in general. And to tackle that unique HIV virus, I think we need something more very detailed, more focused. But I'm hopeful that we'll have that in the near future.
We all are. How does the COVID vaccine interact with HIV meds? Assuming this is ART. What is the interaction there, if any, or do we know yet?
So for now, we do know there is no interaction with the HIV medication per se. In fact, one of the medications that just got approved for Paxlovid for treatment for COVID exposure within the first 5 days has an HIV medication part of the regimen to combat that, to control the symptoms when somebody's exposed. So we definitely know there's no interaction.
Okay, so that's well understood. That's not something we have to wait for more on. That's known at this.
Well, it's fairly new. Again, it's not. It's an emergency approved. Where obviously with medicine in general, in science in general, COVID in general, now we always are striving for more data, more knowledge to understand things better. I think more things to come as Paxlovid is now going to be prescribed more. It just started, a couple of weeks ago. So we'll see more things that might develop.
I wanted to ask you about that. Well, we have a few minutes left here.
Sure.
For anyone who hasn't followed, there's a new form of injectable PrEP that has been approved for use. And Amit, I wonder if you talk a little bit about what it is and how folks can get it, maybe both Chase Brexton patients and others who might be watching this video.
Sure. So cabotegravir that just got approved under the brand name of Apretude as an injectable PrEP. Cabotegravir was also recently approved for HIV treatment as a combination product with another medication. So it just had approval in end of January, and what we're hoping that we're able to have the medication being, and also have our patients access the medication soon enough. But as one might understand that, when the medication is approved by FDA, after that, there's a number of steps that need to take place in terms of production, billing costs, insurance, inclusions, and actually having the medication in the pharmacy to be able to start giving it. And as we start that process, since it's an injectable treatment, it requires a lot of in-clinic workflows to be formed in order to give access to our patients. For example, this is going to be an every 2-month injection, in comparison to a regular PrEP visit, which with an oral tablet, people came in every 3 months. So this would be a 2-month visit, and also it's not going to be a one size fit all kind of thing. It's all going to come down to money, I think. In the U.S. healthcare system, we are so driven and focused by, money. It's we don't think about our patients so much. So the first thing on the menu of things, it's going to come down to, okay, well, whose insurance is going to pay for it? It's going to be a $6,000 to $8,000 injection. Are the insurance companies going to pay for it? Now, somebody can have access to it if I have, patients who cannot tolerate the oral PrEP. For them, the insurance company is not going to have any other way around to get out of that. They're going to have to approve it. It might be a little fight, but they're going to have to approve it. But we're going to continue to strive for to give access to our patients. Our team, our case management team, our pharmacy team are always diligently working with me to make sure our patients get the medications they want or they need, and how can we work better with insurance companies or to fight with them to get this medication to our patients. And I think other factors too that play into a role in here is the injectable is going to be available from the pharmacy versus they come into the visit to see me and they get it that way. So it's a lot of billing cost issues that come into play when we talk about injectable PrEP. But I do think it is going to change the landscape of HIV prevention. There has been a lot of social deterrence. People who are can't come. Cannot take a pill every day, have swallowing issues, or have anxiety to come in the clinic, in terms of the oral PrEP, anxiety with that to be able to get that treatment every month. So just take a shot every 2 months and you're done with it.
Your visits, sure.
Yeah, and so a lot of things are going to become easier, and I'm hoping this will help increase the HIV prevention efforts more, as we have seen this drug was proven to be superior to our counterparts in the trials.
Two very quick last questions. We'll wrap up. On the subject of PrEP, does taking PrEP prevent or reduce exposure to other STIs like syphilis?
The answer to that is no. That's, I stress that so much, even in my PrEP visits, when I start somebody the first time on PrEP, and we talk about that actually so detailed, because everybody asks that question to me.
Sure.
So PrEP is not a replacement for condom use. Condoms are the most effective way with abstinence to prevent STIs. PrEP antiretrovirals that are included in PrEP and for HIV treatment does not prevent STIs.
I see. And finally, I'm going to try and pronounce this. What is Shigella? I saw something on Facebook about it being on the rise. What is it, and how do I protect myself?
So Shigella is it's an infection that can happen. It's a bacteria. It can it's usually it's a GI infection with a oral fecal route, where if somebody does get infected with it, it's not an STI, just to be clear. Shigella can be spread via sex if somebody has it in their rectum or in the stool. It has a lot of the gastro symptoms of diarrhea, stomach pains, and things like that. Prevention for that, I am not sure. If somebody has GI symptoms, don't have sex with them, because you will end up getting it. And also Shigella can also be, people can also get infected with Shigella like bacteria in unhygienic places like pools and such. Foods can also expose you to bacterial infections like that. I think there were reports rising, E. coli is another one. We see a lot of infections, like stomach infections, like, Chipotle had some sort of infection with E. coli in their salads or something. So similar that way. It's not an STI. Anybody can get it in different ways.
I see. Well, I want to thank Amit for joining us. It's Amit Dhir, a nurse practitioner, infectious disease specialist, and with focus on HIV prevention. If you have other questions, go ahead and put them in the chat. We'll try and follow up via comments, and get answers to any questions we can. And again, thank you for joining us. We'll have this on our YouTube page, and it'll be available on Facebook as well. Amit, any last thoughts? Anything you'd like to wrap up by saying?
What I will wrap up by saying is that Chase Brexton is here for our communities. We are here. We stayed open through the pandemic, and we still are giving the best access to our patients. So please come to Chase Brexton if you're looking for a primary care provider or even a HIV prevention specialist. Our PrEP clinic is so much easily accessible for our patients, and I would love to see you to help you with your sexual health questions, start you on PrEP, so we can work together as a community to lower HIV rates and reach that HIV elimination goal, and also lower STI rates as a public health threat to our communities.
Well, thank you again, and we'll see everyone next time.
Thank you.